I'm going to perform a male straight cath today. I would knock on the door, perform hand hygiene, talk to my patient, tell him what we're going to be doing. I would check the doctor's orders. I would verify that it is the correct patient that we're going to do the procedure on, and then I would begin the procedure. First thing I'm going to do is raise the bed up to a level that's better for me. Now I'm going to put the side rail down. Next thing I'm going to do is put on my clean gloves. I've already gotten my warm water ready so I can wash him up. I'm going to pull down his blankets. We're going to do an abdominal assessment. We already know that he has retention in his bladder, but everything else looks good. Put the chucks down so we don't get the bed wet while I'm cleaning him up. Spread his legs a little bit more. So I'm going to come over, get my washcloth, wrap it around my hand, tuck it in, and we're going to go in a circular motion. And then I'm going to turn this around a little bit, and we're going to do the same thing. Okay, then I'm going to take my other towel and I'm going to dry them off a little bit. Okay, now I'm going to get my sterile field ready so that we can do the procedure. So I take off the clean gloves and throw those away to perform hand hygiene. I bring my bed table over and I get my supplies. I look at the bag, make sure that everything is in here that I'm going to need, all the supplies. I check for the expiration date. I open it and I pull out the pack. The bag will become my garbage can. So I'll put that right there for easy access. And then I will open up my kit. Okay. So this we'll put down next to the patient, and curl my hands around and put this down. This will also protect the bed. Okay. I'm going to put my sterile gloves on. I'm going to get rid of this. And then I'm going to move this in between the patient's legs. So I'm going to open up the top of my kit and put that off to the side. I'm going to take the lubricant and I'm going to squirt it into one of these containers. I'm going to throw that away. And I'm going to take my catheter out. I'm going to put it in the lubricant while I'm getting everything else ready. I do need a urine sample, so I will take this out. So placing that on my sterile field. And now I'm going to clean him up. So with non-dominant hand, I hold him and I go in circles with the iodine, throwing that one away. Doing the same thing with this one. And then one more time, just to be sure. So then, I take the catheter with lubricant 2 to 3 inches up, and I insert it with the end in the receptacle, asking the patient to take deep breaths. And then once we have a urine return, I know that I have reached. I take this, I'm going to put it in just a little bit further, I'm going to get my sample, put that back down here, and then I'm going to let the urine run out. And once the urine is done, I will take this out. Throw this away. I will take the urine, put it in a graduated cylinder, measure it. I will then clean up, get everything out of the way, taking the urine, putting the cap back on, not to touch the lip of it, putting it over here. Putting this in my garbage. Clean this up, leaving the chucks underneath. And then I'm going to clean off the iodine. Oops. Going around, turning it, going around. So that's all clean. And I would dry them off. Okay. I would remove my trash. Put him in a comfortable position. Help him back. Cover him up. Ask him if he needs anything. Raise the bed rail back up. Lower the bed. Raise his head up if he requests. Ask him if he needs anything, fresh water. Ask him if he's in any pain. And then I would label the urine sample right here next to him. I would put it on my container. And then I would take my gloves off, perform hand hygiene, and I would depart the room.